D'Andrea. Okay, sorry. So Dr. D'Andrea, I was hoping maybe we could start by talking a little bit about the veterinary urgent care space, because boy, it sure seems like it's very hot right now. Over the last few years, we've seen a lot of growth in that sector. Can you talk a little bit about the background in general, and then specifically VUCC?
Absolutely. So actually started, to my knowledge, the second veterinary urgent care in the country. Urgent Vet and I were about 6 months apart from our opening, so it seems like we had the same idea in opposite states. And I think that we both came from, I can speak for myself. On the emergency medicine side, I mean, we were just slammed, jam-packed, couldn't get everybody in that needed to be seen. And unfortunately, there was so many cases coming to the emergency center after hours that really didn't need to be seen as an emergency. It wasn't a trauma or a hit by car or, something that truly needed ICU care. It just needed a veterinarian to take a look at it and help the patient. But we were hours behind. Veterinarians were working really, really long shifts, trying to keep up on medical notes, seeing everything that we could see, and unfortunately turning away cases that needed help but weren't emergent because we were forced to triage between the most urgent cases versus the ones that were coming in for, an ear infection or an oral hematoma. On the other side, here I was again after that in primary care, and this little dog came in to see me. And there was a woman who presented the dog. She had 3 kids, and her poor dog had a horrendous ear infection, and she waited 2 months because my wait time was 2 months to get in to see me. And I felt so bad for her and this little dog that, a simple treatment, it just needed access. And between emergency care not being able to see the lineup of patients out the door, and then and then in primary care having a 2-month wait time, as a veterinarian, I said, you know what, if I just plot myself down with 5 employees, I'm sure people will call to see me. And that happened in 2017. And here we are, 3 practices, new merger, 3 on the horizon. And it seems like a lot of other people are also recognizing that this is a major need in the industry.
So we talked a little bit about the background with vet urgent care. And boy, Christine, it sounds like a lot of what's driven the dramatic expansion of urgent care on the human side over the last 15 years. Because when humans hear urgent care, what they're thinking is, I don't have to make an appointment, number one. And making an appointment can be a real challenge because I can't dip out of work at 2:15 to go to the doctor's office. I want to be able to go after I'm done with work at 7 o'clock. And then, I don't know that I need to go to the big hospital. I don't have a compound fracture. I just have this condition I'm a little concerned about, and I want to get a professional opinion on. So it sounds like that's a lot of the same factors are driving urgent care expansion in animal health.
Yeah, absolutely, Joey. I mean, you hit the nail on the head. I would absolutely agree. I mean, just back to that other patient that I referenced, the dog with the ear infection. The woman was a working mom, balancing her career and her kids, and for her to take time out of her day, it was just a real challenge. It was a real barrier to getting the patient care.
So you decided to just take this leap, right? You and 5 employees, and start this new venture. What were some of the challenges that you had to surmount right off the bat?
Oh goodness, they were more operational challenges. Zoning, permitting, building, architectural. Honestly, I mean, the medicine is a breeze. I mean, not a breeze, but the medicine is never a breeze. But the medicine I'd done for so long, it's almost like, that I can do without having to really think about it. It was all the other stuff that I mean, I think I have a street MBA at this point.
Yeah, right. So let's talk about sort of the pharmacy and supply aspect of that business specifically. And if we get even more specific, some of the drugs of concern, dangerous drugs, controlled substances that are part and parcel to this kind of work. So throughout your career, what's your experience been with those drugs and the management thereof?
In general, because we have small practices with relatively small teams, we have historically pretty good control. These are the types of things that, you don't want to say I've never had a problem with this, because as soon as you say that, that's when you have a problem. You know, I've been very fortunate as far as management of controlled substances. We've had really good people. We've had really good protocols in place. But at the end of the day, I mean, just like the expansion within the field, we've also gone through a significant expansion. Urgent care was significantly utilized. We filled a huge need during COVID, and we grew exponentially. During that time. And our team also grew exponentially, meaning I no longer personally know every single person on my team, which I did historically. And my license is, you know, I am responsible to the DEA for all of our drug and controlled management. And while I have now one person with a power of attorney who is in control of that at this point, the Cubex system allows us to have much better and much tighter control over controlled drugs. I mean, we can't do urgent care without controlled drugs. Frequently, we need to sedate patients, and that does require use of controlled substances. Frequently, we have patients that need pain management that does require the use of controlled substances. So really, it just is that tightening control of the controlled substances as we grow. Quite frankly, I don't see much. I don't see much of an. I don't really see a different option to tighten that control down.
Let's talk for a minute about this merger, right? So, can you walk us through the timeline of how this happened and where you're hoping to go from here?
It happened quickly. I mean, as you can see, if you've been in the hospitals, I did build the UCC to be a scalable model. I did. I saw a need within the industry. I actually reached out to a colleague of mine who is an MD who built several urgent care or human urgent cares in the southwestern United States. So that was actually my foundation for how I designed BUCC. So I designed BUCC after the human urgent care model. So a number of the systems that we use are pulled from human urgent care. A number of the flows that we use are pulled from urgent care, human urgent care. You know, I thought, why reinvent the wheel? I built it to be scalable. My question was, would it work? Essentially, obviously, it does work. Obviously, as you know, there's a ton of interest in the field. You know, I could have gone to any private equity. I could have gone. I don't mean to say I could have gone anywhere, but I really could have gone anywhere to get funding
Sure.
to expand this. In short, I needed a sound, solid infrastructure with values that matched mine. So
Mhm.
money wasn't an issue. I could have gone anywhere to get money.
Sure.
I didn't want money. I wanted a partnership, and I wanted a partnership with a company who had the same values in prioritizing not only patient care, but employee wellness as I did. And I feel that I found that within SVP. I mean, we can't take good care of our patients if we're focused on the bottom line and the dollar. And quite frankly, in my opinion, cost of veterinary medicine needs to come down as opposed to going up. With the amount of private equity interest, a lot of the money flooding into this industry, I feel that those values are being missed. And I feel very strongly that with SVP, we're prioritizing the right things. Dr. Jay Price, the CEO of SVP, has been an excellent partner. And again, as a veterinarian, it's easy for him to see my focus. So being patient focused and employee focused and controlled slow growth that focuses on doing it right, highest quality medicine, best practices, and really taking good care of our people is the only way that we can not only control costs, but make sure that we're making the patient care the best and the client experience top notch by making our costs as reasonable as we possibly can for the best quality medicine. That is our goal.
Where do you see this partnership going? You have three locations today?
I have 3 locations open and operational. Well, technically 4 locations under construction. We are moving operations. So yeah, the only barrier in the industry is high quality staffing.
Well, that was thank you for providing a segue to my next question,
Yeah,
which
yeah.
is what has been your approach to staffing? Because that's the bottleneck for everybody right now.
So I don't believe in toxic positivity. We have a very strong mission, vision, values that focus on authenticity, bringing your best self to work. We have a very strong mission, vision, values. What I did was, as I recognized that we had this strong growth. I brought all of our team leads in a room, everybody that had been with me from the beginning, and I said, guys, why are you here? Why did you call me for a job? Why did you why did you call me? So we actually constructed our own mission, vision, values from the quality people that have been on our team. And Tom's going to go into those right now.
The group needed to come up with the vision and the mission and the values within ourselves, right? She's had a very strong group of people who've been with her for a long time. They're very loyal, they're very passionate about veterinary medicine, but a lot of people were burnt out in other locations, in other places, and they've come here to find a little more balance in their life, find an opportunity to have more opportunities for leadership, wherever they might want to go within their career. So, I mean, we're an authentic place. We respect one another. We always like to say that the customer isn't always right. There is a respect that needs to come to our staff, because our staff needs to feel protected, wanted, and heard in so many different ways too. So we make sure that respect is a huge part of who we are and what we do. And then, compassion goes a long way for us, whether it's with a patient, whether it's with each other, whether it's giving each other grace, because as we've seen through COVID, the last couple of years, there's a lot of things that are happening outside of people's lives in the workplace, right? So we've tried to establish a true mission, vision, and true north to say, you know what, you might not be having your best day. Animal medicine, veterinary medicine is not all puppies and kittens and all that stuff, right? It is a place where things happen, emotions happen. You might have a really bad day, but you can't let that energy come out because a pet doesn't really understand like that you're having that bad day. It just goes on your emotions. So to deliver the best care, you need to be compassionate and also have that respect for other people. So, but like Christie said, like balance and having a voice, I think for her leadership to be able to get people in a room and be like, listen, I'm not writing these mission, vision, values. I want us to do it. And that was such like an eye-opening experience for me, because I've worked with, I come from human medicine. I was in pharmaceutical for a while. It's a lot of top-down. It's a lot of top-down messaging that come, and you're just kind of like supposed to believe in what comes from the leadership of the company. And what Christie has developed and established is a place where you really do have an opportunity to guide and take this place to where we want to go.
So the reason I need to step in and actually state it is because, quite frankly, at the end of the day, you can't see yourself. And I had this idea that I felt really passionate about. I know how I am, how I practice medicine, but it's difficult for me to summarize in eloquent words why people come to us for a job. I mean, this is just what I do and who I am. And I needed the people that have chosen to come and be on board, and yeah, we all sat in a room and they just talked about what it is that they believe in with vet urgent care. And at the end of the day, it is that mutual respect. It is that they feel protected and supported. It is that, while the world blew up, we had really strong, steady, and stable leadership. At the end of the day, guys, I know this is hard, but we're going to get through this together.
Well, so it's really interesting you say that, and this sort of inspires a thought here. Over the weekend at Southwest Vet Symposium, we had a veterinarian come up to our booth and tell us that she left her previous employer and joined her current employer because her current employer provided Cubex on site, and she felt that was really critical to creating the kind of environment she wanted to be in. So I was going to ask you how this. Let's be honest, there are only so many things that you can decide are priorities when you're starting an endeavor like VUCC. How does Cubex as a priority connect with those values that you guys have established for VUCC?
In general, I think that Cubex provides control and comfort. So if people have a bad experience with controlled drugs, they personally feel responsible. When someone is taking out controlled drugs, no one ever wants to be held accountable to the DEA, especially as a clinician with their license. And if that has ever happened to somebody, I can completely understand why they would choose to come to a company that prioritizes control and back to our values in mutual respect and protection for the staff. Cubex allows us to provide, as a company, that protection on their license, which provides them more comfort in putting their license on the line every day to take care of patients.
That's terrific. And the other sort of element of that control and comfort, of course, is on the financial side, which is something that you've got to think about, especially as you scale. Throughout your career, Christie, um, what has been your experience with, being very care focused as opposed to invoice focused? And, sometimes things get left off the invoice. Have you ever had, experiences where you realize 6 hours after somebody walks out the door, oh, I forgot to bill for the whatever, and that's just kind of part of life. What's been your approach
It's like
to
every
that?
day. Every day. I mean, when you
Right?
have control over invoices as a veterinarian, you're the one that's like, I forgot.
Yeah, right. And it's just like cost doing business, right? Um,
I mean, and sometimes, honestly, at the end of the day, you just want to take care of your patient. And, I think that's a double-edged sword in being both a business owner and a veterinarian, is because sometimes you end up shooting yourself in the foot because you're like, it's okay, it's okay, it's okay. But it's actually, it's not okay. I mean, American veterinarians spend an enormous amount of money. A veterinary medical degree in the United States is a significant financial endeavor. And coming out of vet school, it is appropriate that we charge for what we bring to the table, not only our knowledge, skills, abilities, but our judgment, reasoning, and we should be charging appropriately for that. And we're the worst offenders when it comes to saying it's fine, because it's
yeah.
not. At the end of the day, we do need to charge appropriately for what we do.
And so did the fact that every dose that leaves Cubex is billed for enter into the calculus for you guys at any point in this process, or was that really subordinate to what you talked about earlier, sort of the regulatory risk?
To me, it was subordinate to the regulatory risk. I mean, from my business perspective is if we do the right medicine and we charge appropriately, then finances are not typically an issue. But it is valuable that it's charged every time, because then it's accounted for and allocated every time.
Yeah.
Now, with regard to the inventory management system, that's a different approach. We are trialing that in one of our hospitals, and it is that decision was more of a financial decision. Does this eliminate some operational redundancies and tighten up our inventory control? And that remains to be seen. My hope is that it is. I believe that it does, but we're trialing it to see.
Christie and Tom, I really appreciate your time today, and I can't wait to follow up with you guys once you actually, have the system in place. And I'm sure you're not going to pull any punches when it comes to offering us constructive help on improving our product, because we're on this mission to really help secure these medications and help protect profits for as much of the industry as we can. Right now, less than 10% of practices use automated systems for controlled drug management, and that's just much too small. Human medicine, it's over 90%.
Well, I believe in the short term that will change relatively rapidly. I mean, we are in need of solutions, and that's what's happening in the industry. So I have no doubt that that's the way it'll go.